Yes, Sushil sir, you can start.
Good afternoon, everyone. Am I audible, please? Just one confirmation.
Yes, yes, loud and clear. Yes, sir, loud and clear. You can proceed.
Okay. Dear colleagues and friends, medical education is now changing to meet the demands of the evolving healthcare system. One of the important changes that has happened in the recent times is the implementation of competency-based medical education. CBME, if properly implemented and if widespread adoption is done, has the potential to change the paradigm, have a paradigm change in the way we teach medical students. And hence it is important that we as faculty, as PD students, and as pharmacologists are sensitized and get trained in the concept of CBME. The National Association of Pharmacology and Therapeutics has taken the lead in this regard, and today's CBME Series 3 is a step in this direction. I'm sure you all have seen the timeline of the events that are going to happen in the next 1 month, along with the topics. So as you can see, we are covering a wide array of topics ranging from teaching learning methods to assessments and to feedback. And I'm very happy to inform you all that we have had a massive, huge response to this CBME Series 3 workshop, which is way beyond our expectations. We have had almost more than 400 participants who have registered for this workshop. We have got senior faculty members, we've got heads of departments, we got the SRs, we have got the postgraduate students. So we have a wide gamut of pharmacologists, right from the HODs to our PD students who are the future of our specialty. And I hope and pray that this particular workshop will help us enrich ourselves and train ourselves in this concept of CBME so that we can take our specialty forward. I again thank each and every one of you for registering with us, and let's have a learning together in the next 1 month. Thank you. Call upon Dr. Dinesh Badial sir, who is the chairperson of the workshop, to please share his thoughts.
Thank you, Dr. Sushil. I welcome you all the pharmacologists to the third series of CBME. Demand for training various components of CBME has increased tremendously, as we are expecting a third batch of MBBS in pharmacology, and also there is mandatory implementation of CBME in the postgraduate curriculum. With that thought, we have actually designed the third series of CBME. We hope that you enjoyed it and learn a lot from this. Thank you so much. Ma'am, please.
Dear members of the pharmacology family, good afternoon. The kind of support we received for each of the activities of our NPT is something I cannot explain. The response to an extent that we find it difficult to handle sometimes, and we say stop registrations. I can only say a big thank you to all of you. As always, the speakers and chairpersons have been meticulously chosen. A lot of hard work has gone in. Am I audible?
Yes, ma'am. Yes, ma'am.
A lot of hard work has gone in behind the screens to make this program a useful one and also to come up to your expectations. I thank the entire team for the efforts, including the organizing committee and the resource persons for their marvelous work. I also thank all the participants for your enthusiasm and response. Make the most of this most thought of program. Thank you, Jai Hind.
May I request Kamaal sir, Dr. Kamaal, to please release the workshop video.
Dr. Kamaal, please.
Yeah, I'm sharing my screen, sir.
Yes, video is getting displayed.
No sound, sir.
It's fine, sir. It was just music.
So Dr. Kamaal, it is without the music, otherwise it is running.
Thank you. Thank you, Dr. Kamaal. With that, we will start our proceedings for today. So let me first start by introducing our two esteemed moderators. First, we have Dr. Ganesh Dhakle, who will be the moderator for the first session. Dr. Ganesh Dhakle needs no introduction. He is the professor and head of department of pharmacology at AIIMS Nagpur. Along with that, he is also the Dean Examination of the same institute, AIIMS Nagpur, and also the member secretary of the IEC. He has also been a subject expert of the DCGI New Delhi, and also a certified NABH GCP trainer and NABH assessor of the Ethics Committee. He has organized international conference in collaboration with GMC Surat and Amrita Institute Kochi in 2021. The conference was highly successful. Dr. Dhakle has more than 60 publications and is also a reviewer for more than 10 journals. And very importantly, he is a very, very popular teacher, having received the Best Teacher Award 3 times in 2011, 2012, and 2018. He is also the chairman of the IEC GMC Nagpur and has organized more than 30 workshops on GCP and other topics. And very, very recently, last year, he has received the Hall of Fame Award from ISCR for his contribution to Ethics Council activities. So on behalf of the organizing team, I wholeheartedly welcome Dr. Ganesh Dhakle, who will be the moderator for the first session. Can I have next slide, Dr. Kamaal, sir, please? Now, let me also now welcome and introduce our second moderator, Dr. Bhabagrahi Rath. Dr. Rath is the professor and head of the Department of Pharmacology, VSS Institute of Medical Sciences and Research, VIMSAR, and is also the in-charge registrar of the same institute. He is also the chairman, Institutional Ethics Committee of Trilocha Netralaya, Sambalpur, also the chairman of the IEC of Bhimbhai Medical College Hospital, Bolangir, also the Institutional Ethics Committee of VIMSAR, Burla. Along with that, he is the member of the Curriculum Committee and also the member of the Medical Education Unit in the same institute, VIMSAR, Burla. He's also been the controller of examination in VIMSAR. Dr. Rath has more than 30 publications in national and international journals. I also wholeheartedly welcome Dr. Rath and thank him for taking out the time to moderate the second session. Now we'll start with the first session. May I now request Dr. Ganesh Dhakle to please take the stage and introduce the first speaker.
Thank you, Sharma sir. A very good afternoon to everybody. First topic for today's session is Art and Science of Taking Interactive Lecture in Pharmacology. All of you know that taking any lecture is an art and making it more interactive for the student is also the science. There are a number of ways to make the lecture more interactive for the students. And to focus more on the topic, our opener batsman is Dr. C.M. Kamaal sir. Dr. Kamaal sir is MBBS, DCH, MD in Pharmacology from Central University, AMU, Aligarh. Currently, sir is professor and head of pharmacology at SMMH GMC, Saharanpur, UP. Sir is also the consultant pediatrician at Al Miraj Hospital, Saharanpur, UP. Let me tell you honestly that he is the one of the most dynamic person I have ever met in my life. All of us is having good experience about him, not only as a dynamic person, but also problem solving while running the NPT organization. He is very hard worker, sincere and fully devoted faculty for the pharmacology and its association. Without his commitment, it was not possible for all of us to establish this new association. Apart from former director and founder of Department of Clinical Research, Sharda University Hospital, Greater Noida, Sir is also noted pediatric pharmacologist and author of book Drug Therapy in Pediatrics. He represented a country at International Pediatric Pharmacology Symposium organized by IUPHAR. He is also interested in research, and this is seen through his appointment as Secretary Insurance Ethics Committee in his college. Sir is also certified GCP and medical education trainer. One of the area of his interest is skill lab, and this is reflected through establishing skill lab for practical pharmacology in his department, first in the state according to CBME, and for this he has been widely acclaimed all over the country. So without wasting the time, I welcome Dr. Kamaal sir, a dynamic faculty, to deliver his talk. Over to Dr. Kamaal sir. Thank you.
Thank you, Ganesh sir. Am I audible, sir?
Sir, can you just come a little closer to the mic so it is little feeble? Otherwise, it's all good.
Is it audible now?
Better than the previous.
Okay,
fine, sir.
Audible?
Yes.
And the slides are also visible?
Yes, sir.
Yes,
Clear.
yes.
So, good afternoon all, and welcome to the national workshop of this competency-based medical education series 3. We are discussing over here the competency-based medical education is specifically related to the pharmacology. And the topic of discussion is art and science of taking a lecture in pharmacology and therapeutics, and specifically in relation to making a lecture interactive one. So as the Mark Twain has told, college is a place where a professor's lectures notes goes straight to the students' lecture notes without passing through the brains of either. It is a little bit humorous also, and he was the satirist also, and quite famous person. And as evident from the lecture, it origin from the Latin word lectura, reading, an oral representation of intended to present information or teach people about a particular subject. Lectures have survived in academia as a quick and a cheap and efficient way of introducing the large number of students to a particular field of the study. But there are certain disadvantages that are associated with the lectures, as some of the critics point out that during the lectures, as we all know that it is a one-way method of the communication, and it does not involve the significant audience participation. So participation is lacking, but through the various, using the various tactics, various tips and various methods, we can change our lecture from passive learning to the active learning process. Another disadvantage that is associated with the lecture is that it requires the speaker to possess very effective speaking skills. Many of faculty members may not be quite well in the speaking skills, so sometimes may not be able to deliver a good lecture. And information tends to be forgotten very quickly when the students are out of the class. It is another disadvantage. Lectures presume that all the students learn at the same pace and are at the same level of the understanding. That is the another lacking. And lectures as such are not suited for teaching higher orders of the thinking, such as application, analysis, synthesis, or evaluation for teaching motor skills, or that skills that are influencing our attitude or our values. Apart from these disadvantages, we all are taking lectures. And in the recent competency-based medical educations, the number of lectures have been reduced also. Even though then we know that we, in our day-to-day practice, in our teaching, in our academia, at our medical institutions, we all are taking lectures because there are certain kind of the advantages that are inherent with the lectures. And because of that, altogether lectures removal from the teaching institutions or from the academia institution has not been possible. First advantage is that effective lectures can communicate the intrinsic interest of a subject through their enthusiasm. If a lecture is being taken with the enthusiasm, it can be quite effective and it can communicate the intrinsic interest. It can present a material that sometimes may not be otherwise available to the students in the textbook or elsewhere, that can be taught to, and that is possible through the lecture, because the various kind of the experiences that cannot be shared can be shared through this media of the lectures. It can be specifically organized to meet the needs of particular audiences, can present large amount of the information, that is also an advantage. It can be presented to large audience, and it can allow the instructor maximum control of the learning experience. Lectures present little risk to the students. Now, if we are planning a lecture, a good lecture in pharmacology and therapeutics, how to plan this? So we first need to try to answer these questions, that who is our actual audience. We need to decide whether we are giving a lecture to undergraduate students, to postgraduate students, to faculty members, to the delegates, and what is the purpose of our lecture. If the lecture is basically being given for just making a kind of the curriculum that is needed as per the course, and what is the time available for a particular lecture. Keeping the time frame in mind is very important. And what is the subject matter of the lecture. And apart from this, what are the various teaching tools and aids that we are going to use, and how we will be using all these tools. Now, there is a quite debate and discussion among the faculty members. It is the choice also that some of the faculty members still prefer marker and the board for taking their lectures. But PowerPoint presentations and PowerPoint is in place for past 20 years, and it has made a lot of progress. And there are certain kind of the advantages that are inherent to the PowerPoint presentation. In my personal opinion and my personal experience, I am using both PowerPoint presentation as well as marker and board. So if some kind of the explanation or some kind of the things needs to be explained, I used to use the marker and board. There was a story in the Kanpur city that about 25 or 30 years back, when the laser cataract surgery have not been established well, some of the ophthalmologists were still doing the cataract surgery with the traditional method. They have not switched over to the modern methods. And with the passage of time, a lot of disadvantage and the roaring practice have been compromised, because with the passage of time, we know all that now it is the era of the laser cataract surgery, which is quite without a complication and giving excellent results. So my opinion will be that if we are having something in our hand in the form of the PowerPoint presentation, those who are using only marker and board, they should also try PowerPoint presentation. Now there is a word of lecturalgia, and it is we all know that the concentration is during the lecture is quite not stable, and it is the frequent cause of morbidity for both the teachers and the learners. The etiology of lecturalgia is multifactorial, and multiple lecturing pathologies are quite frequently coexisting. This is the graph that I am presenting is SAC period, that after a concentration during a hour, this is how the attention span of a student is declining. We can concentrate at the most for the 20 minutes to any form of the lecture during the concentration or what is being discussed. After that, we need to apply certain kind of the strategies so that all of the students needs to be awakened up all the time. And there are the certain perception of the poor lectures. Student perceptions are different and teachers' perception of the poor lecture are different. While students are thinking that if they have not been given ample opportunity of the questioning and objectives were not clear, it is the perception of the students. While the teacher's perception is they are thinking that if there are too much of the content and he may not be able to cover all the part, he is thinking that his lecture not gone well, and there is a lack of preparation, sometimes problem with the audio visual aids. So the student perception is quite different in poor lecture as compared to the teacher's perception. Now, preparation of the good lecture, we need to collect all the information beforehand, and we must categorize it in the categories must know, should know, and nice to know the knowledge that we are going to deliver through the lecture. Say, for example, if I'm going to take the class of cancer drug, I will not go into the much details of the various kind of the various anti-cancer drug that are being used, because as we know that at undergraduate level, the kind of the knowledge that they require is not exhaustive knowledge of the anti-cancer drug is not desirable. And we can, according to the competency also, we can also divide our area of must know, should know, and nice to know. Then knowledge of the audience is also very, very important. We need to know the baseline level of the knowledge what our audience are having. It may be helpful to start with a general discussion, and we can ask question in between to get the opinion. So this approach sometimes is very useful, and we can make a last minute adjustment during the course of lecture if the need is arising. Say, for example, if I am taking the lecture of antiemetic drug, I will explain in detail the various causes that are associated with the vomiting. I will fully explain with the help of the diagram first before going into the details how the drugs are acting in the patients. I will also then, through the help of the various kind of the images, trying to explain where these drugs are acting. If we can make an image, the understanding of a lecture is quite prolonged, and students are taking a lot of interest during the course of the lecture. Then generating an interest, we can try lot many strategies. We can try narrating a real life story, that is encountering a patient with the cardiac arrest when we are traveling, or we can demonstrate certain kind of the experiment also. Recalling the experiences of the students as a patient or an attendant in a sick family member sometimes may help and can generate a lot of interest during lectures. Then there can be problem solving that can be solved by the students. Now, we can also start our pharmacology lecture before going into the details of the drugs with the case scenario or clinical scenario first. Say, for example, if I'm taking the drug of the psychoactive or psychotropic drug, I will be explaining students a real case scenario that how a particular patient who is having seizure disorder fall onto the road, and he has been given the first certain kind of the basic aids, then he can be shifted to the emergency ward, and where the various kind of the psychotropic drugs and various psychoactive drugs have been applied and have been used for this patient in the category of the benzodiazepines or non-benzodiazepines or the barbiturates. Now, there are the various strategies of making a lecture quite interactive, and there are certain kind of the engagement triggers. What are these engagement triggers? Is that, as I have already described, that there is a SAC period. After certain period of time, student attention start decreasing. So we need to apply engagement triggering, so that student can take interest all the time during the course of the lectures. So what are the difference between a lecture and interactive lecture? And an interactive lecture, a teacher has prepared and planned a lesson in details by following a very good mix between the lectures, and he is also applying another teaching methods also. A teacher should not talk in a lecture for more than 20 minutes, because I have already explained that our attention span start decreasing. So there are the various methods and tips to make our lectures an interactive one. We can use the strategy, what is popularly known as think, pair, and share. In this strategy, think, pair, and share, we can divide students in some parts. We can ask the student that they can think, and then that information they can share with their colleagues also. And then that particular kind of the information can be shared with the class. How we can apply the think, pair, and share in the pharmacology class? I am taking the example of the cost-effective prescribing. That is pharmacoeconomic exercise. I am asking the students that they can think of it, and then in the pair with the partner, they can discuss this, and they share their experience with the whole class. In this way, we can make our lecture quite interesting and quite interacting also. Then another method is popularly known as jigsaw technique. What is happening in jigsaw technique? It is a cooperative learning strategy that enables each student or of a home group to specialize in one aspect of a topic. That in jigsaw technique is as the process is deriving its name from the jigsaw puzzle, because it involves putting the various parts of the assignment together to form a whole picture later. The assignment is divided into parts, and the class is also divided into the same number of groups so that of the assignment. Here I am explaining it with the help of an example, how we can apply jigsaw technique in pharmacology and therapeutics. Here I am taking the example of the corticosteroid chapter, and where I am dividing students in 3 groups. In one group, I am asking the students to only discuss and take the various from the various resources, the general principles of the use of the corticosteroids. And in another group, I am telling the students that they should gather the knowledge about the adverse drug effect of the corticosteroids. Then the third group, I am asking the student to study the contraindication of the corticosteroids. Now from each and every group, I am taking one student, I am combining them, and then these students are pairing, and then with the jigsaw, because each students from the different set of the jigsaw technique is having the complete knowledge. When they are combining together, then they are putting the exact scenario with it. Then there can be a demonstration of the pathophysiology. If I am taking the example of the drugs that are being used in uterus and childbirth. Here I am showing a video also. Students,
Genital obstetric gel is specially developed to facilitate the vaginal birth. Genital has only a physical effect. It does not contain any drugs. The body does not absorb the gel. As the labor starts, and when the cervical dilatation reaches 3 to 4 centimeters, one of the 2 disposables highly adhesive A injectors is taken. The applicator is attached to the tip of the injector. The injector is gently inserted to the vagina, and 3 to 5 milliliters of the gel is applied to the external part of the cervix. For each, the vaginal examination.
Childbirth. Then, of course, in our day-to-day practice, we all are using the concept map in the pharmacology, where we are showing that in the concept map, here you can see that whether in the chain phospholipids the steroids are working and where the COX-1 and COX-2 inhibitors are working, so that student can create a kind of the map, and it is quite be helpful in understanding of the various complicated aspect of the lectures. And we can also use the flipped classroom that aims to increase the student engagement in learning process. This topic is being taken by my colleague Dr. Sudha also later. Part of it, I will not be going into the details. Then we can discuss with the student the muddiest point. What is muddiest point? It gives students opportunities to point out what is most confusing about and clearly explain what is muddy. If we need, we can ask students if we can explain that muddiest point or difficult part of a chapter, then a student can take a lot of interest and the lecture can be made quite interactive one also. Opportunity for questioning is very, very essential, and open-ended questions are an important tool for promoting understanding and making a lecture quite interactive. Then respecting the clock all the time needs to be important. If our lecture is of 1 hour duration, we should not take, we should not try to take the knowledge in excessive amount and later on try to vomit it out in the morning lecture. We need to try respecting the clock. If our lecture is allowing 60 minutes, we should try to finish it up. Here again, I am using a video, audio, visual aid also, and you can see how I am explaining the method of a drug, mechanism of action of a drug.
Before going into the macrolides topic, let's first discuss about protein synthesis steps in bacterial protein synthesis, transcription, and translation. First, let's talk about transcription. For the bacteria to begin protein synthesis, the double-stranded DNA molecule must unwind and separate in the region which codes for the specific protein. Only one strand of DNA serves as a template. Transcription is carried out by RNA polymerase, which results in the formation of messenger RNA, which is an exact copy of the DNA segment. Now in translation, when the strand of messenger RNA is complete, it detaches from the DNA template, and ribosomes get attached to messenger RNA. Bacterial ribosomes are made of a small 30S and a large 50S subunit. After the two subunits join together,
then another tip is we should avoid reading from the slides. Ideally, the slide should not look like this, that a lot of information is there and we are only reading from the slides. See, if students are coming to the class just for the reading purpose, a lot of material is already available to these students at their hostel room. They can study, there is a lot of, but why they are coming to us, why they are attending our lecture is that through the lecture, our main aim is to develop a kind of the interest among the brains, among the budding doctors, so that if the students can take interest, they can learn the topic through the self-directed learning also. And about these slides, it is again a topic of the quite big discussion and some another day separate class can be taken about the slides. General recommendation is that taking a lecture 1.5 or 2 minutes should be given to per slide for 1 hour slide, and for 1 hour slide 25 to 30 slides should be more than enough. And we should avoid too many transition effects as we see in some presentations. In my lectures also, I am again showing students the various drugs that are available in the market. Here, I am showing the dinoprostone gel. So once I am showing this dinoprostone gel in my PowerPoint slide, when in the evening wards or when the students are going for the ward teaching, during the clinical posting, when they are looking at the dinoprostone gel, then they are developing a lot of interest in our topic of pharmacology and therapeutic. Then giving notes to the students is also important. What is the practice that I am observing over here in my lecture is that I'm not giving altogether lot of notes to my student, but some parts of the notes, say for example, classification of antiemetic drugs, I ask students that they should write. So at least the students, once they are writing through their hands and their brain is also involving, they can be able to remember for a prolonged period of time. Or at least the first year MBBS student or second year MBBS student who have never heard of any antiemetic drugs, at least should be able, he is able to listen a antiemetic drug for the first time. And it is prolonging in his memory also. In this summary, I can say that effective lectures can communicate intrinsic interest of a subject through their enthusiasm. They can present material not otherwise available to the students. They can be specifically organized to meet the needs of particular audiences, and they can present large amount of information to the large audiences, allow the instructor maximum control of the learning experiences, and use of the interactive lecture, various kind of the strategies. If we are using of making our lecture quite interactive, then the boring lectures can be avoided, and it can promote a lot of active learning, heightened attention, motivation to the students. We are able to get feedback to the teachers and the students, and it is increasing an idea of satisfaction in the brain of the both student as well as the teacher. So with these words, some kind of the acknowledgements, and thank you very much for patient learning. Thank you. Jai Hind.
Thank you, Kamaal sir, for your widespread presentation. In your presentation, you have included most of the things which are important to make the lecture interested, like how to make the PPT, what is SAT period, then how to use the case scenarios to make the lecture interested, what are the engagement triggers and how to apply it. Another model like think, pair and share model along with jigsaw model, concept mat, how to use the AV aid, and we can give the notes to the students also. I hope that this would be a grateful help to the all participants to make the lecture more interested. Now, if there are questions, we can take the questions for 4 to 5 minutes. Till then, my simple question is there any online platform which is available to make the sessions more interactive?
Pardon, sir?
Is there any online platform available to make the session more interactive?
So there are certain kind of the platforms that are coming up in the market, and through these availability of these platforms, for example, from where we can also get feedback from the students. It is possible in the online lectures also.
Yes,
and,
yes.
And through that, by getting the feedback from the students, like it is, we are looking at the Kaun Banega Crorepati, that he is taking feedback from the audiences. It is generating a lot of interest, and it is helpful in making the lecture quite interesting and quite interactive also.
My second question will be, how interactive sessions are more beneficial to the students?
Sir, as I have already explained that there is a SAT period, and after a period of, we all know that we can concentrate at the most of 10 to 15 minutes or at the most of 20 minutes. So after that, our concentration period is start declining. So if we need to keep student awake all the time, after that particular time, we need to apply different strategies. Say, for example, I am explaining the mechanism section with the help of the images or with the help of the animation, and I can discussing after a particular time a case scenario, and after a particular time that I'm taking the student feedback. I'm asking the student that they should give me in writing on a paper slip without revealing their name what is the difficult aspect of the today's lecture, and then if the slip is passing on in the class then at the end, I am collecting and I am able to get the feedback, and through that, I can improve my lecture.
Yes, sir. At the end, I can say that if any participant is having any query, they can write the question in the chat box. During the meantime, Dr. Kamaal sir will answer it. Due to lack of time, I conclude this session. Thank you very much, sir. And now I hand over the session to Dr. Babagray sir for next topic. Thank you, sir.
Thank you.
Thank you, Dakle sir. This is Dr. Babagray Rath from Bimsar, Burla, Sambalpur, Odisha. So good afternoon, one and all. It's my proud privilege to welcome you all to the second session for today of this national workshop, Online Learning Series 3 on Competency-Based Medical Education in Pharmacology. At the outset, my sincere thanks to Kamaal sir for his excellent presentation on the topic Art and Science of Taking Interactive Lecture in Pharmacology, and Dr. Dakle sir for a smart moderation. My heartfelt gratitude to the organizing chairman, Dr. Badial sir, organizing secretary, Sushil Sharma sir, and our national coordinator, Kamaal sir. This session is on flipped classroom in pharmacology concept and approach. Simply telling, can tell ordinarily, first the topic is taught in the class, and then assignments are given to the students and they complete it at home. Then we discuss it. But flipped classroom, as simply telling, the role is reversed, the time phase is reversed here. It is an instructional strategy and a type of blended learning. This aims to increase student engagement and learning by having pupils complete reading at home first and then work on live problem solving during class time, and not the usual other way around. So a novel teaching learning approach indeed, so far as we are concerned, and hence the topic would be interesting to one and all. Now it's my proud privilege to introduce our honorable speaker of this session, Dr. Sudha MJ Madam. Dr. Sudha MJ was formerly Professor of Pharmacology at Ajijia Institute of Medical Sciences and Research, Kerala, and Member Secretary, Ajijia Ethics Committee, SACRC member, Medical Education Unit Coordinator, and Member Curriculum Committee. She has 12 years of teaching experience in medical, dental, paramedical, and allied health sciences. Currently, she is Director and Course Coordinator of Helios Med Education, Head Medical Affairs of MedTech Company, Chairman, Institutional Ethics Committee, and Basic Medical Scientist in 3 other ethics committees. She is also an NABH Ethics Committee Assessor, as well as a trainer in NABH GCP certification workshop. She is also a member of many respectable professional bodies such as FERCI, Indian Pharmacological Society, IMPA, ISRPT, and our own association, that is NAPT. My best wishes to you, respected Sudha ma'am. So esteemed participants, let us listen from our expert, Professor Sudha MJ ma'am, on flipped classroom in pharmacology, concept and approach. Over to you, madam.
Thank you, sir. Good afternoon to one and all. Somebody has to confirm I'm audible and my slides are visible.
Yes, madam, you are audible and your slides are there.
Thank you, sir. Thank you, Dr. Rath, for that brief introduction. First and foremost, I would like to thank NAPT and Dr. Kamaal and Dr. Padmaja and the entire team for organizing this session, and most importantly, giving me this opportunity on the same platform as my mentors here. Many of them have mentored me for my pharmacology. And thank you so much. I would like to start the session. And as you all have heard about lectures, Dr. Kamaal gave a wonderful presentation on how an ideal lecture should be taken and make it interactive. I am a fan of interactive lectures because I have removed my conventional lectures from my routine sessions. I make them interactive even otherwise. So we all know the advantages and disadvantages of lectures and difficulty in making them interactive, because now many institutions or organizations have very big classes. I mean, the number of students per class will be more. So we cannot remove lectures altogether from the curriculum for multiple reasons. One, being too many students, we have less faculty, we have too much to teach in too less time. And with the introduction of competency-based medical education, it has become quite a challenge. So there are multiple ways of making lectures interactive. On a similar note, I would like to say flipped classroom technology or tool that we can use is also a blended learning platform. It is not a replacement for lectures, but we can make lectures more interesting, or rather, it is a different type of session. So this presentation for the next 20 minutes, I'll be talking about. First, I'll introduce you to the concept of flipped classroom, the various components with one example, most important advantages and disadvantages, and I'll summarize it. So Sir has briefed all of us about the traditional classroom pattern, where we introduce new content to the students in the classroom, and then we give assignment. Whereas in a flipped classroom method, what we do, as Dr. Rath rightly introduced the classroom for all of you, we flip the whole process. Like, we are going to introduce the content before the class. I'll tell you how we can do, or what are the various steps that we can use. So we are introducing the content well in advance, before. We are familiarizing the students with the content. Okay, and this content is very well curated. It is not just like, okay, there are so many videos, Sir also put up some videos, so much of content, open, content is seamless in today's technology. But the specialty of a flipped classroom is we are curating the content. You can have your own content or create or borrow the content or videos, but you are curating it completely. And then you're presenting it to the student. So in flipped classroom, you give the content to the student, then you conduct the class, then after the class again, you do the assessment. That is the concept of flipped classroom. So for this blended learning technology, you could do it virtually or in person. Both are possible. Similar to, because of the COVID, we know what all has happened so far. So, So there are three main components in flipped classroom. Three main components of flipped classroom, which is a very active learning. This inverts the traditional learning experience. We have the before class activity. This is for the instructor or the facilitator. I consider myself as a facilitator for or a medical educator. Meaning to say, earlier days, we used to come and teach and go. Nowadays, it's a concept of facilitating the session. So before the class activity, during the class activity, and after the class activity. Now, first of all, we should know, why should we consider this a flipped classroom activity? Why? Because it takes a lot of time for the instructor to prepare for these sessions. It has advantages, disadvantages. But why we do these sessions is introducing difficult topics to students, making them familiar before they come to the classroom, and having certain pre-curated concept teaching in the class will help them understand or have a better understanding of the concept, or it will provide an opportunity for the student to understand things at a higher level, apply this knowledge, whatever they have learned, the theoretical aspects, application. It gives time for them to interact with their peers and with the facilitator to move forward. It will give a deeper understanding of the concept. So basically, we do this for, not for, of course, all topics. We have to be very choosy about the topic we are taking. Even in that topic, we can even choose what specific learning objectives, the SLOs that we choose. We can either have for all SLOs, or we can choose specific SLOs and prepare content accordingly. So this brings the learning from teacher-centric to student-centric completely. Here, there is active learning because student is actively involved. It doesn't mean that the instructor or the medical educator or the facilitator is inactive. They are also very active because they have to curate this whole process. So it will help student progress further from what they have learned to its application. So higher order thinking, what we call, can be easily, it can be achieved. Maybe we can make the student understand one step further. Concept construction, they can create scenarios, they can analyze and understand what they have done, learned. Before classroom activity, there are a few steps I would like to say. In this before classroom activity, we have to identify the specific learning objectives. I'm sure Dr. Kamaal will arrange an entire teaching learning technology sessions where you will learn how to prepare a very good specific learning objective. So identify your SLO, whether you want to take one SLO or more than one SLOs. How much time do you have for the session, before the session, after the session? Because as we are all aware, our time is the main criteria here, and the quality of the content. Prepare the content accordingly. Share the content appropriately. Ensure that the learner has, you have to engage the learner. Even when before the classroom, you have to make sure that the learner is engaged. You know that they have viewed the content. If you're sharing lecture notes, you should make sure that they have understood it. So attach a Google form with it. If you're putting on a video, you can, I'll give you some examples of that. So the last part is you can even take analytics. If you're using YouTube videos, it is very simple. You can go to the analytics and look into it. If you have a very well-established learning management system in your organization, or you have you're using any of the LMS, HeliosMed is one such, which we have put up some content on HeliosMed. We're using an LMS. We are using Moodle for that. And you can put up content, you get analytics, whether the student viewed, how much they have viewed, what they have studied, or how much interaction they have had, all the analytics before the class. So before you enter the class, you know which student read it or which student didn't read it, or how many answered, how many did not answer. Okay, so these are the before classroom activity for the faculty. That is, identify the SLOs, prepare appropriate content, share the content, ensure that the learner has engaged with it, analyze before the class. In-class activity. This is a specialty of flipped classroom. See, this in-class activity has to be planned very meticulously. This in-class activity, again, should not be an elaborate lecture, because that will, again, you will be talking about the same content. So what you can do, you can use the jigsaw method, which Dr. Kamaal just mentioned. You can use other techniques. You can break the class into smaller groups. You can reinforce the key learning objectives. You can bring in contextualization of the content. Okay, this gives freedom. When you break the class into smaller groups, you don't have to make them sit separately. It can be conducted in lecture halls, or it can be conducted on Zoom classroom. But still, you can divide them into a few smaller groups so that your SLO, if it is a single SLO, you can break down the SLO and teach, or if it is multiple SLOs you're trying to reinforce, you can teach multiple SLOs as well. So whatever you have given, okay, on that, you can build further in the class. The concepts can be built further. You don't have to repeat most of it. You can elicit from the students. Time is the constraint here. So please keep in mind about the time and what more you want to add during these sessions, and what is the kind of in-class activity that you would like to do. Okay, then you can have a small assessment activity attached to the in-class activity. You can actually plan a 5-minute or 10-minute activity for assessing how much they have understood before the class, during the class. Lastly, there is after-class activity. They have to evaluate whether the students have learned it or not. The further concept building happens after the class. You can share further material, or you can reinforce on the shared material or content. You can have a feedback session. You can talk to the students on different platforms, which I'll be talking about. You can give them content or homework kind of thing after the class also for further elaboration and self-directed learning. This entire process, we can do it synchronously at one point of time, either through virtual classroom or in person, or it can be asynchronous. It can be done at the student's convenience. All the material that you have loaded, I'm sure during COVID, most of us have taken classes virtually. All of our presentations are still there. Student can go back and read anytime, right? So they can do all this at their own time and convenience in a flexible environment. So flipped classroom components: before class activity, during class activity, after class activity. Okay, I'll take a simple example of the competency 1.19 to describe the mechanism of action, types, doses, side effects, indications, contraindications of anti-epileptic drugs. First of all, we have to write up SLO for this, whether we want to teach only the what is given in this competency, or you want to add on few more things, like you want to advance it and give them an opportunity to treat as well, right? And you can set induction for these classes also. So this could be a simple SLO. At the end of the session, you should be able to, here you is referring to the student. Okay, they should be able to define epilepsy, classify anti-epileptic drugs, list the side effects of commonly used anti-epileptic drugs. Instead of writing commonly used anti-epileptic drugs, we are going to give the specific drug there. Okay, list the side effects of so and so drugs. List 10 indications, 10 contraindications, 5 indications, 5 contraindications. So these are the things that students should be able to do at the end of the session. This is like general SLOs for lecture as well, right? If Kamaal sir was taking a lecture on this, this is how his SLO probably would look like, right? So we can use the same SLO for conducting flipped classroom as well. So we can use this. We can either stick to this, add on further. Okay, we could use handout notes, videos which are curated exclusively for this. We can have a PPT presentation already prepared with all the content. But for me, PowerPoint presentations is always like, it should not make us powerless. So my PowerPoint presentations will have very minimal content. So I would rather prefer a PDF content over PPT, because it will have more content. Concept maps, which sir already introduced all of you to. So we can give content in a variety of ways. These are only a few examples I have taken. You can give content in many other different forms as well. Now again, coming to the flipped classroom video development, this is a very important aspect. Your videos should be very tailor-made videos. You see, not all of us are proficient with video making, but there are very simple tools, okay, with which we can make videos. Some of them are like, KineMaster videos, Vimeo videos. You can use your regular mobile phones to prepare videos. You can make your own videos. It can be narrative videos. You can add questions along timeline. If you're using a learning management system, most commonly used one for medical education is Moodle. So I'm going to take the name. So if you're using an LMS platform, in your video, you can even put questions along the videos. So you can make video, you can put it up on the Moodle platform. You can also integrate questions along with it. Okay, what is important? Very beautifully, Kamaal sir said you have to set induction for lectures, right? You have to set induction for lectures. When you're setting induction, in your videos also, you have to set induction. There should be something that introduces the person, individual to the topic. Then it should be short. We can have 1 hour videos also. We can have 5-minute videos also. The specialty of flipped classroom videos is like, see, we can have shorter videos. I prefer shorter videos because all over the internet, wherever you go, or people who are familiar with videos, you will understand that the attention span or learning ability of an individual is only for 5 minutes. So your videos which you prepare should be less than 5 minutes, should contain everything that you want to tell in a nutshell. Okay, if you want anything elaborate, put it on handout or put it on PPT and give. That is better. So you set induction, have a voice modulation. There should be not much background noise. You can use regular modes to record. Size of the video. See, again, whenever we are sharing videos, the size matters. If you're making very bulky videos, see, today's my presentation, I wanted to share it. The PDF came into 40 MB. If it is a 40 MB, if you're in a network area where you cannot download or view, then it doesn't make sense. It should be very minimal. The size of the video matters. So a little bit of technology, learning a few tools will come handy. Have subtitles whenever possible. It will be helpful. These are all different platforms or tools that you can use. You can use Zoom recording, a simple regular recording with a mobile phone. You can do, or with your laptops, you can do KineMaster, InShots, Adobe Premiere Pro, paid version, free version. whiteboard animations, Doodle has got both free and paid versions. These are simple video tools which you can use. I feel these are very simple to use. Anybody can make videos, right? Again, please note, whenever you're making your own videos, please add on-screen activities so that you can engage the student or engage the learner, whoever is viewing it. You can engage them if you have on-screen activities. Because of very limited time, I'm not having on-screen activities right now. Usually what I do, even in my Zoom sessions, I put some questions on chat box. I tell them please answer, so that I know how many. See, here there are around 400 people, 380. It will be difficult for me if all of you start sending in chat boxes. But usually in a lecture class, if you're having, you can have, even in your videos, you have on-screen activity. In the analytics, it will show up. If you're doing a virtual classroom, you can have on-screen activities along with the presentation side by side or inbuilt on-screen activity. Both are possible. If you're using a borrowed video, okay, that is from either YouTube or Khan Academy. Khan Academy is very popular for their flipped classroom method. That is, they have recorded all the videos and they have put it up for view. There are 10-minute videos, 15-minute videos, 30-minute videos, a 2-hour video. So it depends, because the learner can learn a different types. Speed pharmacology notes. You can go into different courses, videos, like in Udemy or Coursera, where there are free courses which you can choose. But this is for the instructor. Don't just give out these options. Don't tell your student, just go to the YouTube and look up. No, here in flipped classroom, what we are trying to do is we are curating the content. So you find the content in the YouTube, you go look for the authentic video. This is for borrowed video. If you're making your own video, you don't have this headache, okay? These are just some examples. You can go for better versions or better places to look for your videos, but commonly used by everyone, YouTube, right? Everybody uses YouTube. So you find your good videos on mechanism of action, uses, adverse effects, indications, contraindications, which will give you either PPT wise made into video or somebody speaking, or you can have your own and put it up on your YouTube channel. You can do anything. In addition to that, for epilepsy, anti-epileptic drugs, you can share the video of, since you're doing a flipped classroom, you have the opportunity to share more content. You curate your content to include types of epilepsy, what the phases of epilepsy, if at all, you're looking at a particular type, that is prodromal stage, ictal, post-ictal. Find some nice good videos, put it up. Adverse effects. You should be such that, like, the student should never forget. You find videos which students will remember. It should be short, sweet, simple, easy to understand. Language, again, if it is in UK English or US English, sometimes people may not be familiar with that accent. So make sure or ensure that your students can understand the videos that you are looking up at. Patient experiences, you collect 1 or 2. Bystander experiences from the videos I'm saying, okay, first aid, sir told, Kamaal sir told, if it is an epilepsy patient, the student should know how to provide first aid. So you take all these videos, either you put them, all of them into one video, you curate it and send it, or you send multiple videos, number it accordingly, name it appropriately, and share the videos, okay? So this is a simple example of a YouTube video, okay, of seizures. This is taken from the USMLE YouTube video. See, if the students see this kind of video, I don't think they'll ever forget. This is again enacted. This is not a real one. They have enacted for the purpose of education. So you can borrow such videos from various platforms. This is another video, which this is again a video. If you see, it is a 8.5 minute video, which gives all the drugs, how it acts, mechanism of action, exclusively, what point it acts. See, benefit of this kind of video is students will be able to replicate. If you're using a 3D video, okay, for the same purpose, if you have very high-end, high-quality videos, they may not be able to rewrite it. But the advantage of this kind of videos is student will be able to replicate this knowledge. They can pause, they can move forward, they can come back, they can learn. If they forgot something, they can hear again. These have subtitles. They also give voiceover, and they can access it from anywhere. Okay. Now, the third part, once you have prepared content, appropriate content, now you have to share the content. Most simple, easiest, which uses very minimal data, WhatsApp. Everybody has WhatsApp, but some people may not agree that you don't want to use WhatsApp or other social media. You can always use other platforms like Google Classroom. So previously, doctor was asking what are the platforms that we can use for having virtual or interactive classrooms. Google Classroom is one such. You can use any LMS. Moodle is one example. You can even use YouTube lectures or YouTube channels, YouTube, just like that. Okay, you don't have to have an account. You can directly use it. Gmail, Google, I have seen a lot of people still using older mails like Rediff, Yahoo. They're not bad, they're good, but Google Workspace or Google Workstation gives a lot of opportunity for development. I'm a big fan of Google. I take almost an hour or two to train my students how to Google properly and find appropriate medical content. That is very important. Same goes with the medical educators. Everything is available on search engine. See, if you ask anybody, they'll say Google, but there are other search engines. I'm not sure many would even know, but they exist. Okay, but Google is one important way that you can spread your messages. WhatsApp, Telegram for bulkier content. You can use Telegram. Instagram, Facebook, so many different platforms are available, which students of today are using. So if you are a part of those, please use. I'm sure all of them have WhatsApp, or majority of people went for Google Classroom because it was free during the COVID period. They may have their own LMS. I have seen deemed universities having their own LMS. So your IT department will help you, share the content. Now, ensure the learner engagement. How can you do that? If you're using an LMS, include assessment sheet into that. Use Google Forms, SurveyMonkey. There are multiple different, methods or forms available for virtual, looking for whether they have understood or not. You can share worksheets, okay, for assessment. Analytics before the session. You have already prepared your content or borrowed your content, curated it nicely, shared it. Now analyze before entering the class. Tomorrow is the class. Today I want to see how many people. This is the personal account of this lady who has a channel, who has a Google form. She has shared, and this is a Google Analytics. How many people viewed? Who all viewed? You can even track who all viewed. Okay, how much, for how long? Did they skip the video? Did they just jump and go? A lot of things can be done with YouTube videos analytics. This is a YouTube video analytics. This is a Google form content. So many people are not aware of the YouTube analytics. Please understand, YouTube is a very powerful tool. You can look into who has viewed, when they have viewed, how much they have viewed. If you are sending a 1 hour video, I don't have that much time. I will definitely not go through immediately. I may go through later, but if tomorrow is my class, I will not be looking into the whole thing. So, you get the analytics beforehand. Then you be prepared to go for during the class session. What do you do in the class? See, your students already have learned the key things, aspects. They have also, you have shared additional content with them. So reinforce the key learning objectives. You can do this by having them either into small groups. If you cannot break them into small groups, make them small, things parents share with Sir told you can do from wherever they are, small teams, or you can make fishbowl, inner circle, outer circle, or you can make 4 different corners. You tell them, okay, this, and anti-epileptic drugs we are talking, you take 4 groups of drugs, 4 classes of drugs for all 4 groups. That way, reinforcing, first of all, reinforce the learning objective, whatever you are there for. Then you build upon whatever already exists. Okay, this is the advantage. Contextualize your content. This is where your role comes in. In a typical lecture class, we get 2 hours, right, for anti-epileptic drugs. 1 hour, next hour, either continuously or as a breakup. So In the 2 hours, you cannot do everything. Every student, if you want all students to learn and understand, add videos like how Dr. Kamaal showed you, beautiful videos, add them into your content. Okay, build on whatever has been learned or taught in the first 20 minutes. You have already gone back to the SLO, mechanism of action, classification, side effects, everything you have finished. Now, come, give some case scenarios. 4 teams you have already divided. Give them, you have already shared the videos of these also. Already you have shared. You're re-emphasizing. You're making them talk. There is more interaction. There is time for participant to take over and give you more, or if they're talking and there is something wrong, you can easily point out, no, that's not how it is. Okay, you give them more here. You concentrate on all these aspects, whichever we want to stress in the routine. We can, bring out more and more from the student in this particular session. And you can also bring in some higher order thinking by explaining additional concepts like patients living with epilepsy, how they can be, or professional and personal implications. You can either elicit from them, or you can give out. They will be more receptive now that they have already learned about what the drugs are, how they should be used, AEs, everything. Now, if you are giving something more, which is more clinically oriented, more practical, they definitely want to listen to this. You ask for their experiences. Ask them, did you ever encounter any patient with epilepsy or seizure? Did you see a patient who had a convulsion? Did you notice anything? How did you manage? Elicit more. Give them. If a student is having a disease or disorder, then how will that student perform, or how should they be made to, you basically engage with the students, okay? Educate the individual and family. Give them what are all the precautions that should be taken when they see a patient or when they see a bystander with epilepsy. So these kind of higher order thinking can be brought in. This gives out another 20 minutes opportunity time for additional concept or doubt clarification. There will still be time remaining. If you are curated your class content beautifully, then you will definitely have time for this. Okay, so finally, in the last 10 minutes or 15 minutes, you can always have assessment integrated. You can have MCQs, you can have, probably one word, one sentence answers, case-based MCQs, single best response. You can have a pre-built worksheet. It could be, again, virtual or physical. Okay. Then evaluate the learning. Okay, this is third part. After the class activity, what will you do? Now we finished the before class activity, in class activity. We are moving on to the after class activity. Evaluate the learning. You can do SAQ, LAQ, case-based questions, MCQs can be given. Okay, further concept building. You can introduce them. Once now the class is over, they have taken it well, you have introduced newer concepts, you have brought them into higher order thinking, and we want more from them. We are not happy. We are facilitators, we are their teachers. Tomorrow, if we see them, we want them to be good and great doctors. What do we want? You can introduce newer things for people. Not all students will be, doing all this. So this can be given as an optional or to induce some people who are interested. Some students are interested more in some activities. If a family member is suffering, if they themselves are suffering, or, they just get interested in neuropharmacology, neuropsychopharmacology, they're interested. Then for such people, this will help. You give them to all, but some people may pick up more. So further concept building, you can introduce newer drug targets, how drug repurposing can be done, patient advocacy groups. You can introduce them to these things in second year itself. Okay, then tell them about the networks which work with epilepsy and patients with epilepsy. NGOs, introduce them to smaller things. This is after class activity. So you can do it on whatever platform you have shared on the same platform. Okay. You can also ask them to SDL, self-directed learning. You can tell them, see, I have discussed only a little bit of, etiopathogenesis. I have not even touched upon it. Please go back and read etiopathogenesis. This can be a pre-class activity also, or you can make it a post-class activity also. Etiopathogenesis of epilepsy, investigating an epileptic patient. Curable causes of epilepsy. How many of the students will actually know curable? We always talk about treatable, right? There's only one or two that I know of. I know only one. Anyway, curable causes of epilepsy, history of anti-epileptic drugs. So these are all special things that we want more from the student. And this is possible with flipped classroom because we have a post-classroom activity. This can be done for lectures also, I would do. Okay. So with that, I have given you a before class, during class, and post-class activity with a simple example of anti-epileptic drugs because it's a difficult topic, right? Not all students will be able to see all the, if you are having 250 students and you have shared the content, you think all 250 have seen or read or come prepared? No, they're definitely not. But a lot of peer learning happens. And you can also give an opportunity, if your videos are short, in-class opportunity to view them. Kamaal sir beautifully told humor is important. One of his slides is saying humor in class is very important when you're taking lecture. Make them let them have fun, make them, involved, interact. Okay.
Dr. Sudha, madam, I think we are coming to the close of time.
I'm done. Okay. So advantages, disadvantages, you already know. I don't have to go into details of this. We have discussed this in detail. So basically, flipped classroom addresses all the stages of Bloom's taxonomy. Before class talks about remembering, understanding. During class, applying, analyzing. After class, evaluating, creating. So to summarize, most important, before class activity, curate your content, prepare your SLO, share it. Interactiveness, integrate. For further in class, reinforce the concept, assessment. Post class, more concepts, assessment. Okay. So with this, I end my session. Thank you so much. So there is a flexible environment, intentional content. Please be aware of the intentional curated content, learning culture, professional educator. Thank you so much. With this, I end my presentation. Thank you, sir. Over to you. I'll stop sharing.
Thank you very much, and many congratulations as well, respected Sudha ma'am, for your excellent presentation with detailed elaboration of the major processes involved. And I think it was really great learning for all of us. And I understand that we could set aside some topics of pharmacology for flipped classroom, and which ideally would be taken up on the initial parts of the weekdays, like Monday or Tuesday, where students have read in the weekend certain things about that, and then can take students' feedback, then really move on with the concept. And very nice, really. It is something really enjoyable for all of us, and our esteemed participants must have learned a lot about it. Thank you very much, and over to Sushil Sharma sir. Thank you very much.
If there are any questions from the participants, please type them in the chat box. And in the meanwhile, I thank both the speakers today, Dr. Kamaal and Dr. Sudha, for making excellent presentations and giving our workshop a head start. And so we will proceed from here to the next subsequent lectures in the next week, where we'll be talking about a very, very important concept of creating long answer questions, short answer questions, and MCQs. So these are the things we'll be covering next week. But for today, we bring our session to close, and we hope that all of us have gone back enriched, and at least a few concepts which we have learned today, possibly we can think of applying. And in the end, we hope that the students will get benefited. So I thank all the participants, all the speakers, the moderators, and all the esteemed faculty who are there for today's session. Thank you. And we will see you again on 11th of August at 3 p.m. for the next session of CBME Series 3. Thank you. Thank you very much. And Jai Hind.